Hi there, Dr. Sharma here from Cosmetier. I help my patients feel confident, look amazing and natural and have radiant, healthy skin for life. And in today's video, I want to talk to you about how you can look more youthful and have smoother, tighter skin if what you're seeing in the mirror are these nasolabial folds and these jowls. So before we begin about how to treat this, it's really important to understand what's actually happening underneath your skin. So as well as your skin superficially losing its collagen and elastin and the hyaluronic acid production going down, underneath, much deeper, what's happening is the supporting structures of your skin, which is the bone, the muscle, the fat, is shrinking, except for two areas. Now, those two areas are your nasolabial folds and your jowls, and we know from medical science that both those areas actually increase with age, where everything else decreases. And what happens is that if you imagine that supporting structure being your wooden table frame of your face, holding everything up, that's shrinking while the skin, which is your tablecloth, is getting heavier and thicker because these folds are getting heavier, that everything falls down and your skin no longer has that nice, youthful, tight appearance anymore. Now, the way to address this is generally different for each person and for each side of your face, because different sides of your face will age very differently. So the most important thing is to have a consultation so you can find out exactly what's happening. But when someone comes in to me and presents with those nasolabial folds are getting heavier and these jowls are getting more obvious, my aim is always to pull the skin back and take the pressure off the fold and these jowls. So we want to pull the skin up, or we might want to pull the skin back if it's the jowls that is causing the problem. And the way I would normally do this is by using a hyaluronic acid dermal filler called teoxane, especially if I'm working in this mid-face area. For the jowl area, the dermal filler may be slightly different. But for this area where we want to deal with the nasolabial folds, and it's usually our starting point, even if you have jowls, we do tend to start in this area because we want to pull everything back and support everything, take the pressure off the folds, take the pressure off the jowls, so that actually your skin looks tighter and smoother and more youthful. Now, the way that I particularly treat this area is by looking at where it is that you've actually lost your volume. Now, for most people over the age of 35, it happens to be in this sort of triangle here. And we know we've got discrete fat pads quite deep in this area. And we also know that we've got superficial, more fat that's kind of pulling the skin back and giving it that smoother tightness. And generally, when we're treating this area, then what we want to do is very gently and very subtly place some structure and volume in this area and then smooth it out so that actually what you're getting is that smooth, tighter look. Now, I would normally do this with a cannula. I tend not to use needles when I'm treating this area. So we generally just insert a little insertion point here, and I can do everything with a cannula where I'm using the cannula to fan the material in really thin threads all the way down here, and also to place it deep where you've lost your volume. What this tends to result in then is that you then tend to get a bit more plumpness to your cheeks, everything's pushed up, you get this instant refresh, and your skin becomes smoother, tighter, and more youthful. And actually, we get this more kind of emphasis up here and less emphasis down here. You may have noticed people, older people, where they get heavier down here, so they tend to get like more square shaped, or what we call the inverse triangle, where they're wider here than they are here. And what we want to do with treatments such as these is to give you back structure so that you're wide up here, slightly narrower down here, so you've got more of that sort of triangle going on and everything's pulled back, but still, most importantly, keeping you looking like you, but the best possible version of you. So I hope this helps. If this is a treatment that you would like to explore, then the first step is definitely to book your free video consultation so that we can sit one-to-one in a virtual space where you can explain what's actually bothering you, what's going on, and I can assess how your skin is by getting you to pull it and to touch it and then we can really assess what's going on, so that then you can get all the information that you need to make an informed choice about whether you want to proceed with treatment or whether there's some other treatment that would be better for you. So if this is something you want to explore, use the link below so you can book straight onto my diary and we can get that call scheduled as soon as possible. I look forward to seeing you. Bye-bye.